My name is Ashley Staggs and I'm about to give my speech on CPR. I have 10 people present in my audience, including my cameraman. The materials I'm using for this course is a CPR mannequin and a CPR mask. First of all, I'd like to thank each of you for taking the time out of your day to participate and being my audience for this speech. I want to start off by telling you a short story. I want you to imagine a typical summer day. You're having a cookout with your family and your friends. You have steaks on the grill and you're relaxing, soaking up the sun as you engage in casual conversation with your family and friends. Suddenly, the laughter of your children in the background turns to screams. Your 12-year-old nephew, who doesn't know how to swim, has fallen into the deep end of the pool. What would you do? Would you know how to save his life by administering cardiopulmonary resuscitation, better known as CPR? According to the American Heart Association, each year 350,000 people lose their lives to cardiac arrest before ever reaching a hospital. A stunning 200,000 of these lives could be saved if CPR had been administered soon enough. Accidental injuries, including drowning and choking, are the leading cause among death in children in the U.S. each year. When responding to a medical emergency, there's 3 main steps that you could take. First, you want to survey your scene. Second, you want to contact medical emergency professionals. And third, you want to start CPR. When you approach a victim who appears to be unconscious, the first thing you want to do is survey the scene. For example, if you're in a pool area, check to be sure that there are no extension cords or electrical cords in contact with water. Be sure that you and the victim are safe. Second, you want to ask someone to call 911. If there's no one available to make that call for you, you need to make the call yourself to get medical professional help on the way. The next thing you want to do is start CPR. To do this, you kneel down beside the victim's shoulders. You want to check for a pulse and breathing. Always use the look, listen, and feel technique. Look to see if the victim's chest is rising. Place your cheek next to the victim's mouth and nose area and listen and feel for breathing. If the victim does not have a pulse and they are not breathing, you want to administer 2 rescue breaths. Be sure that there is an airtight seal around your mouth and the victim's mouth to make the chest rise. And then you want to again check for a pulse and breathing. If the victim still does not have a pulse and they are still not breathing, then you will begin chest compressions. To do this, place 2 fingers directly below the breastplate in between the rib cages. Take the palm of your left hand to place to this area, and then take your right hand and place on top of your left hand, interlocking your fingers. Keep your arms straight, elbows locked, and your shoulders should be above your hands at all times. When giving compressions, you want to compress 1.5 to 2 inches into the patient's chest. You will give 30 chest compressions. The ratio for CPR to breath to chest compressions is 2 breaths to 30 compressions. You will do this in 4 cycles. After the 4 cycles of 2 breaths and 30 compressions, you will then check again to see if the victim is breathing and if they have a pulse. And if they do not, you will continue this process until professional help arrives on the scene. So now that I've shown you how easy it can be to save someone's life, I encourage each of you to take a CPR training course. You never know when you may be in a situation where you need to save the life of a family member, a loved one, or maybe even your own child. When someone stops breathing or their heart stops beating, it only takes 4 to 6 minutes without blood flow or oxygen to the brain to result in permanent brain injury or even death. So now that I have shown you in this short demonstration how simple this process is, I encourage you to take a CPR training course. Thank you so much for your time.